in some other areas related to public health. So excited to have joined the team in Broomfield, and yeah, happy to work with all of you.
Thanks, Dr. Belknap. And again, we're thrilled to have you on board. And also our team has just been ecstatic about working with you thus far. And I'm sure council is going to find the same experience. So let's go ahead and dive in on the current situation and where we're at. If we could go to the next slide. So as far as what we're seeing, the key takeaways is that if we remain on our current trajectory right now, there's a chance, and it's a very reasonable chance, that our hospital will demand exceed 2,000 beds in the next 7 weeks. And later on in the presentation, I'm going to talk about why that's such an issue and problem, not only for the state and the region, but also for us in Broomfield and how it impacts every one of our residents. Secondly, what we know is that interventions to reduce disease severity or reduce the spread of infections are really important right now to substantially reduce hospital demand. So that includes looking at monoclonal antibody treatment and expanding that statewide, having higher booster uptake across the state, and then higher vaccine uptake in children. But the one thing that we do know is these interventions, if we implement them now, most likely will not impact hospital demand until January or February. Therefore, there's the need for interventions that can, on the short term, reduce transmission and address the exceeding hospital capacity. And those are some of the things we're going to be discussing later in the presentation. Broomfield as a county continues to have low hospitalization rates, and that's due not only to our high vaccination rates, but also I truly believe it's because Broomfield follows a lot of the public health guidance that's out there and takes those into place as far as making decisions. So we know that behaviors in addition to vaccines are what are the most important factors in reducing transmission. I will be providing an update today regarding what's happening on the policy front in the Denver metro region. And I'm sure you've seen the news that many metro counties are planning to implement local orders that are requiring masks or vaccine verification in all indoor facilities. We in Broomfield have also looked at that approach, and I'll talk about this more in depth later, but we're looking to take a more tailored approach that fits the needs of our community. And that's looking at issuing a mask order for all of our city and county of Broomfield facilities, and then allowing fully vaccinated individuals to opt out if they can show proof of vaccination. And our hope by this is to sort of lead by example and encourage our local business community to follow suit and join with us to help control the spread of the virus and save our hospital system. So next slide. So this just shows you where we're at as far as our 7-day incidence of cases, not only in the state, but here in Broomfield. And what you can see is that we are starting to see a decline, a slight decline, both in the state and here in Broomfield. Again, we're in a very unstable place with this virus during this place of transmission. And so until we see a couple weeks of that decline in cases, it's really hard to say that we've begun to turn the corner. And ultimately, what we want to do is start to drive those community case rates back down to the place where we were at in early fall to set us up for a successful spring and summer. And then if you could go to the next slide. Also importantly, similar to what we're seeing happening in the state with hospital capacity, we thought it was important to show what's actually contributing to our case rates in Broomfield and where we're at. And we decided to break down the data by those that are fully vaccinated and those that are unvaccinated. And remember, the unvaccinated also includes populations that aren't eligible or just became eligible to become vaccinated. And what you can see, and it sort of speaks to what we've been seeing happening play out across the nation and statewide, is we have a much lower case incidence in our fully vaccinated population versus in our unvaccinated population. And this just speaks to the strategies we've talked before about needing to really increase vaccine uptake in those that are currently unvaccinated. And as we discuss further, continue to provide boosters to those individuals 18 and plus to keep their levels of immunity up. Next slide. So this just shows where Colorado is. And we're definitely heading in the wrong direction as a state. You know, regionally, what we're seeing is in the Mountain West region, both high case rates and high hospitalizations. And as scientists, we can't pinpoint specifically what's contributing to that. You know, some people believe it's due to the fact that more people are moving indoors during this period of the year. Others speak to behaviors and policies that are in place. Obviously, the high infectiousness of the Delta variant plays into this. But with all that being said, what we tend to see happen is that there's these similar rises in cases by regions, and this happened last year. And I often get asked the question, well, why aren't we seeing the same fall that we saw in the southeastern states where they had that dramatic increase and then the dramatic decrease? And one thing that's been speculated is we have higher vaccination rates in the Mountain West region. And so that could be leading to this plateau in cases. And again, the second thing what we see is, and why we have such high hospitalizations, is the Delta variant is extremely infectious compared to the original strain and the Alpha variant. And it does find and seeks out and finds those that are unvaccinated, which leads to the potential for greater severe COVID disease, hospitalizations, et cetera. Next slide. So we're definitely not in a good place when it comes to overall hospital capacity. What you can see here is out of our currently hospitalized confirmed COVID patients, we have 1,574 individuals that are hospitalized statewide. This is higher than we've been at any time during this year. Our hospital systems have developed and implemented combined hospital transfer center plans, and that's activated to Tier 3. And we're going to talk a little bit about the crisis standards of care, and also if we do need to go down to the area of rationing care, and Dr. Belknap is going to go into more detail as far as what that means. Next slide. So in addition to what we're seeing statewide, what we're seeing in the North Central region is that hospitalizations continue to increase. And so we have 775 people that are hospitalized right now. That is an 8% increase from the past week. And our ICU bed capacity is at 94.3%. So that means, and I believe as of today, we just got new data saying that we have less than 5% ICU bed capacity available in the North Central region. Next slide. And when you look at the new hospital admissions, one thing that looks a little bit promising is we're starting to see that tick down in the state. But we are, again, not sure if this is a trend or what's happening as far as just in the past few days. We'll have to watch that more closely, but you can see from the Colorado hospital admissions how we're definitely on that same trajectory that we were last year with significant and severe impact on our hospital capacity. And you're seeing the same thing in Broomfield, although what we're seeing in Broomfield is we are seeing our hospitalizations, but our rates are much lower compared to the rest of the state. And again, I fully believe that's because of our highly vaccinated population and those that are seeking out boosters. So we did have a day last week where we had over 5 people that were admitted to the hospital. But we've said all along, we're looking at that severity metric. And if we exceed the number 2 as far as the hospital counts for our 14-day hospital admissions, and we're not there yet. Next slide. And this just further demonstrates what I've been saying, and the state presents this all along. I think the important thing for us to keep in mind here is obviously hospitalization rates are very correlated with vaccination rates. But as we start to talk about regional strategies, I believe this slide just really demonstrates the need for statewide action. We have certain counties that have low vaccination rates and extremely high hospitalizations. And it's been pretty clear in those counties that they're not able to enact some of the mitigation measures that are needed due to a variety of reasons. And that only leaves our statewide action as the next tool to begin to control statewide spread. Next slide. And this just shows as far as our 7-day hospital admissions, and this is what I was alluding to a little bit before. Broomfield's doing extremely well. We're at the very bottom as far as our 7-day hospital admissions. We might see this tick up in the next time they run this data because we had 5 over that period of time, but we'll continue to trend in that area. I think that's what's most striking here is when you look at this slide, the metro area has fairly high vaccination rates across it. And what you can see is the rates for hospitalizations are really low in the Denver metro area compared to our other counties in the state. But when we go to the next slide, Jacob, if you could go to the next one, what you see is even with those low hospitalization rates per 100,000 in the Denver metro area, just due to the sheer number of people, we still see a high number of hospitalization counts. And so El Paso County is leading the way with 135 hospital admissions over the last 7 days. But then we have Arapahoe and Denver County that are included in there. And Denver County actually has a higher vaccination rate than we here in Broomfield. So it's just, again, due to the sheer number of population size in the metro counties that demonstrates that there's a need for regional action. What you can see, though, is in Broomfield is both our rates and our number of hospitalizations or counts are extremely low. So we're not the county that's contributing significantly to the hospital admissions and the potential breach on the hospital system. Next slide. And the governor's talked about this a lot. What we know is statewide, 82% of those people that are hospitalized or unvaccinated. So you can see we do still have some breakthrough cases of individuals that are vaccinated and do become hospitalized, but it's very low compared to those that are unvaccinated. And we track this here in Broomfield closely. And see if we're looking to see if we see a trend that begins to change. And in October, we saw over 71% of our hospitalizations were among unvaccinated. In November, as of now, it's 60% that are unvaccinated. We'll see if that continues along that trajectory as we saw waning immunity start to come in, and the need to boost up, especially our older adult population. And lastly, we had 4 deaths in October and 1 death in November. And again, that was among our more vulnerable population. 2 were fully vaccinated and living in nursing facilities, and the other 2 were not vaccinated. Next slide. So this slide is really striking, and I think it's one of the most important slides of why we're in this situation. What you can see is our statewide hospitalizations are increasing along that trajectory that I mentioned before. But the big difference for us as an overall hospital system is our total beds available for COVID in all conditions is decreasing. And what you can see is our staff bed capacity in December 2020 was 3,600. And in November 2021, it was estimated at 2,185. So when I say we're on this trajectory, a 48% chance trajectory of having over 2,000 hospitalizations, that's cutting it extremely close with the number of hospital beds projected for November, and then looking at December. And then the second thing is, the most important thing is that staffed bed capacity. And we know staffing is a major issue in the hospital system and healthcare system right now that we'll discuss later. So next slide. So this just shows you the percent of ICU beds in use in the Mile High region. That's what we're part of in that North Central region. And so you can see our regional bed capacities at 7%. Some of the regions across the state are at 0%. And this is why that hospital transfer system is so important right now, is the flexibility to transfer patients based on that bed availability. I do want to call your attention to the graph in the lower right, the NCR staffed ICU availability percentage. So this is the key graph, I believe, is because we're not only talking about the number of beds, but we're talking about those beds being able to be staffed. And what you could see in the month of November is we've been consistently below that 10% line. And that's not where we want to be. We'd love to be in the 10% or higher range. So contributing to this is not just only our overall COVID hospitalizations, but also people that are going in and needing care that they haven't received before. And then again, the availability of staffing within the hospital system. And Bob will speak a little bit to what we're hearing about staff burnout that's occurring within our healthcare industry. So next slide. So I am going to turn it over to Dr. Belknap now to talk about the crisis standards of care and sort of where we're at now, and then what it means as far as the next step if we do have to go to rationing care. Bob?
Yeah, thanks, Jason. Before I get to the rationing and crisis standards of care, let me just emphasize the point that you just made, which is that the strain on the hospital systems is not only COVID. And so we're talking a lot about COVID, and appropriately so, because that's a transmissible infectious disease that we can do something about with some of our behaviors as a community. But we're seeing people hospitalized for other illnesses, some of which were related to care that they delayed seeking, for the past year and a half because of fears for COVID. We're also seeing increase in hospitalizations related to the fact that people are moving more. We're back to sort of pre-pandemic levels of interaction and travel, and that leads to accidents and injuries and things that were around before COVID. And so all of that together, along with a surge in COVID, is what's straining the hospital system. And then you combine that with the fact that we've lost healthcare workers. And so we have fewer staff, and so fewer people to staff beds. And so if that trend continues in terms of the surge in COVID and the need for hospitalization, then that's where crisis standards of care become implemented. And you may have seen there was an article in the Denver Post that the headline is taken from here, and I think people are very interested in thinking about the rationing of care, and that's an important consideration. Before we get there, what happens with crisis standards of care is we stop providing the routine screening for other health conditions, so cancer screenings and other outpatient treatments and what are elective type procedures that still may be very important and may lead to bad health outcomes for people down the road. But we stop doing those things and we reassign staff to help in hospitals who maybe don't work in hospitals normally. And we change things like we allow nurses and others to care for more patients than they normally would care for. And so that, by its very nature, if you normally have, 2 patients to 1 nurse because of the severity of their illness, and now you're at 3 or 4 patients. Well, that you still have 1 nurse and that person has a set amount of time that they can devote. So now you're spending less time with each patient. I mean, you may have people who don't normally work in ICU settings now being asked to work in an ICU, and so those are some of the changes that happened first. And all the hospitals have plans for that and the ability to surge. And so it might be that we could get through a worsening where we didn't reach the level where we had to make decisions about rationing care. But I can say that to put that burden on an already exhausted and stressed healthcare worker staff is going to be detrimental in the future months, because it's going to lead to more burnout. We're going to lose more people deciding that they don't want to work in healthcare anymore. And 2 months, 3 months, 6 months from now, we're all going to be worse off for that, because access to care for COVID and non-COVID is going to be limited. And then the most extreme example, if we really exceeded even our surge capacity with regard to staffing, then it really would be making decisions about who gets care and to what level they get care, and the ways those decisions are made are through the use of some sort of standard formulas as described here, importantly to really try and make it as objective as possible, so that we avoid decisions that are being made based on race and income and disabilities and other as sole factors. And so but as with any sort of system like that, it's going to be flawed, and again puts even greater strain on healthcare workers who really just want to provide the best care to everyone we see. And so being asked to make decisions about who gets care and who doesn't get care, will only hurt us, because we will lose more people as a result of that. And we heard that from places like New York that had to implement some of these things when they were in the midst of their worst surges of COVID last year. So.
Yeah, thanks, Dr. Belknap. And one thing I often hear from others is, well, if this situation is so bad, can't we just begin to refuse care to those that are unvaccinated? And, our hospital system, thankfully, has a Hippocratic oath and ethics in place, the ethical decision-making that, you have to treat everybody regardless of how they got in there. And so we're all in this together, I guess, is my point, regardless of if it's individuals that are unvaccinated that are impacting the hospital system, or vaccinated, or others that are seeking care. And that's where we all really need to come together to see whatever we can do to reduce the strain on the hospital system, especially during the next 2 months. So if we could go to the next slide. So one thing that I think caught most of us in the metro region off guard and really just honestly was alarming was the latest modeling data. And so they ran multiple scenarios with the modeling data to see what was going to happen as far as our hospital demand in the next 7 weeks. And what they found is there's a 48% chance that our hospital demand will exceed 2,000 in the next 7 weeks if we remain on the current trajectory. And they are including sort of that modest increase of Thanksgiving and our late December holidays of reduced transmission control. And then within the modeling, they run multiple scenarios. One is looking at booster uptake. This is what the governor's really been focusing on, trying to get 75% of eligible adults boosted by the end of the year. Looking at the current data, we're not on track to meet that scenario for the state. So I think that it's a good goal, but highly unlikely. The second thing is looking at both high booster and pediatric vaccine uptake. And that will make a difference, as I mentioned before, in reductions in hospitalizations, but it won't impact where we're at in this current period of November and December as far as high hospitalizations and reduced capacity. So even if we do hit our vaccine targets, there's a reasonable probability that we will exceed hospital capacity in 2021 without additional interventions. And some of those interventions are looking at expanding monoclonal antibody treatment across the state, and that could have short-term reductions in transmission and have an impact on hospital demand. And then looking at transmission control, and the modeling team looked at what's happening as far as some of our proven strategies for transmission control. Obviously, mask wearing, social distancing, hand hygiene, all of those pieces, mobility. And it's been proven that mask wearing has unequivocally shown to reduce SARS transmission. That's not even debated in the scientific community. What they're looking at is within the current context of what's happening across the nation, if we would see a dramatic impact if there was a statewide mask mandate on our hospitalization rates. And they have limited evidence to point to that in the current environment, but the evidence is still evolving in that area. So I just wanted that to be extremely clear with council. We are seeing from some other counties some data that looks very promising, though, with having universal mask wearing and decreases in hospital admissions. So next slide. And this just further illustrates what I discussed, is what you could see is on our current trajectory, it's not looking good. If we have our high booster and pediatric vaccine uptake, the probability of us exceeding that 2,000 beds goes from 48% down to 46%. So a very small impact. If we have the short-term increase in transmission control, this is the strategies we're promoting in the region. We see that go from 48% to 30% probability. And then lastly, if we can increase monoclonal antibody treatment to 50% of all eligible people, we could see another significant impact from 48% to 25%. We're striving to get there. I think, again, the challenge is, will we really reach that 50%? by the time we begin to hit this peak. And we'll just have to see how the rollout of the monoclonal antibody treatment goes statewide. Next slide. So just as a reminder, in Broomfield, we're doing extremely well with our percent of our population that is vaccinated. And what you can see is we've had a pretty high uptake thus far in our 5 to 11-year-old population that has initiated vaccines. We are still seeing others that have initiated vaccines in all other age groups, but we've seen a pretty significant increase in our 12 to 15-year-old age group too. And all of that is great. But the key thing for us to keep in mind is, we want to have a highly fully vaccinated population, but we also have to account for waning immunity in those individuals that are immunocompromised. So if we go to the next slide, this is why we believe it's so important in Broomfield that we're providing booster shots specifically to our 60+ population. And as usual, Broomfield continues to do extremely well with vaccine uptake and with the booster shots. What you can see is we've already have almost 16,000 residents that received an additional dose. What you can see is 65% of our fully vaccinated 70+ year olds have received their booster shot. And we're at about 50% with our 60 to 69-year-olds. As you heard, the CDC recently announced it following Colorado and other states' leads that anybody 18+ can also get their booster shot. That's due to waning immunity after 6 months. We encourage everybody to do that as well, because it not only helps address severe COVID disease, but helps reduce community transmission. Next slide. So we've been discussing this a lot as a Denver metro region, and you can look back at recall, I should say, the data that I presented on both the hospital admission rates by county, and then just the overall total number of hospital counts or admissions. And what you see is we have low hospital admission rates in the metro area, but we still have high hospital admissions when it comes to the overall counts. We've met numerous times with the state health department and with the governor's office. And we as a metro region have requested statewide action with a state indoor mask order, and also looking at having vaccine requirements or programs in place, especially in high risk areas. It's been fairly, or I should say, clear from the governor's office that we don't anticipate any additional orders that are going to be forthcoming. So with that, the metro region thinks it's important that we step up to do our part to reduce hospitalizations, at least from our counties, that can then hopefully create a bit of a breather for the overall hospital system. So our regional partners, this includes Tri-County Health Department, Jefferson County Health, and Denver Health, are all currently meeting or going to be meeting with their boards of health. And they're looking to implement local indoor mask orders in all public settings, or participate in a vaccine verification program. And what that program entails is that you have a policy that all of your staff are vaccinated, and in addition that you're checking the vaccine status of anybody entering your facility. We looked at this closely in Broomfield, and over the weekend, after discussions with the other health departments about the vaccine verification program, and also looking at where we're at as far as our overall hospitalization rates, we thought it would be better to take a more tailored approach. So what we're looking to do in Broomfield is lead by example for our business community and others. And by that, we're looking to implement a public health order for all of our city and county of Broomfield facilities. So masks would be required for all individuals, staff, and patrons age 2+. And then fully vaccinated individuals can opt out if they could show proof of vaccination. So within our city and county buildings, if we're doing specific classes or events or whatever it may be, if we want to go through that process of having individuals show that proof of vaccination, we could have those events, or we could have individuals take off their masks in those settings. Obviously, those that are unvaccinated would still need to mask up. Our hope is by reaching out to our business community and demonstrating where we're at with the current situation, that they will follow suit and either encourage or require mask wearing within their specific business settings. And we're looking for the duration of our order to go from December 1st through December 31st. Couple of key things to keep in mind is that we'll message out to the community that we're going to really say we're all in this together, as we have throughout this entire pandemic, and promote our vaccination in our unvaccinated, our 5 to 11-year-olds, and the booster uptake, but also encouraging our residents to choose wisely where they're going and seeking information before going out. So they may want to be informed if they're visiting an establishment that requires masks or does not require masks, or an establishment that does check for proof of vaccines. So really giving our residents the best tools to make really informed decisions. And then lastly, if we begin to see our hospitalizations significantly increase in Broomfield, obviously we would reconsider this and look at more aggressive mitigation strategies that we can take. So next slide. And then I just wanted to remind the council that we still have our other orders that are in effect. We have the state mask order that requires masks in all health facilities, jails, homeless shelters. And then we have our Broomfield mask order that requires masks for anyone ages 2 to 11 in schools and childcare facilities. And next slide. I believe that concludes our presentation. So we're happy to take questions you may have. If you can just use the raise hand function. We'll go ahead and call on you, and it looks like Councilmember Hinkle had the first question.
Thank you, Jason. Thank you for this presentation and all the hard work you guys are doing. I know that this is hard, especially coming into winter. Part seems like forever, not even part 2. It seems like part infinity. So I appreciate all of your work, and Bob, thank you as well for everything that you've done and really taking care of our healthcare workers. I do worry about staffing, and I hear about that a lot. I have a really simple question, and I don't know if this has already been answered because I didn't make it to the last COVID meeting. When we talk about vaccination requirements or proof of vaccination, are we saying proof of the original vaccination or proof of the booster?
So the way that the other health departments are implementing it currently is just proof that you're received either the first dose of Johnson & Johnson or the 2 doses of the mRNA vaccines, the Pfizer and the Moderna. They're not including the booster yet, and that's because we're waiting for the CDC to come out with a definition of what fully vaccinated means, so that we stay consistent with the data and the science.
Okay. All right. And then I'm curious, I do worry about staffing as well as at businesses. If we're encouraging businesses to follow along, we've had major staffing issues. And I think I worry about them now having to be the sort of gatekeeper on requiring vaccines or proof, to have a vaccine and not wear a mask or whatnot. Have you guys thought about how we can support our businesses and the staff as far as that's concerned?
Yeah, so obviously there's a bunch of materials and tools that we have available that we could provide to our business community. One thing we've been talking with Jeff Romine is could we have maybe a business town hall or forum where we share some of these best practices or strategies with them on how to do this. And the other thing is we think it's really important for the business to make the decision based on their need. We're aware of where we were last year with our business community with all of the restrictions that were in place. And by working with the business community versus mandating it, we think we'll get greater buy-in, not only from the business, but from the customers that are going there.
Okay. And what are we doing on making vaccines more available for staff, for our restaurants and our businesses that have a lot of high turnover in their staff, and a lot of them are working really hard. So I'm just curious as to what sort of availability can we have for the cooks who are working constantly and they say they don't want to take off time to get their vaccines. How do we bring it to them?
Yeah, so obviously we know that there are opportunities for people to get vaccines through pharmacies, through their healthcare provider, and other situations. But we know there are certain populations, homebound seniors, those individuals that maybe their employer is not giving them the time off they need to get the vaccine, even though that is a current requirement. So we're looking at what we could do in public health to continue to fill those gaps and make sure that we're getting the vaccine to those that need it the most.
Thank you very much.
Mayor.
Thanks, Jason. Well, I guess my question is, how is Louisiana, with their very low vaccine uptake, doing so well? Or better?
Yeah,
because it used to be this hotbed of, COVID activity. So how did that happen? And
I'll let Dr. Belknap weigh into this as well. But one thing that I've heard is it was sort of that seasonality effect during those times. Obviously, you had people that were indoors because it's very hot and humid. A lot of mixing that was going on during those times. And then on top of that, low vaccination rates. And so what you saw was the infection ran very quickly through those populations and then dropped off significantly. And I think that's the $1 million question is, why did it drop off significantly? The hypothesis is that you saw immunity sort of ramp up too in those people that were unvaccinated, because they became affected. And we do know there is natural immunity that occurs when you've been affected with the Delta variant. But Dr. Belknap, what have you heard?
Yeah, I agree with what you said. And I guess I would also say, in a short answer, we don't exactly know. We're fairly confident they didn't reach herd immunity in Louisiana or in Florida. So it's not as though that their total population immunity is higher than what we have in Metro Denver, and certainly not with what you all have in the vaccination rate at Broomfield. So we do think that it's some changes in where people were congregating. So instead of indoors in air conditioning, they were, things were able to move outdoors because of changes in the weather. And that we're experiencing this, sort of beginning in early fall with the reopening of schools, and then continuing, to today, is the, change in behavior in areas where the weather is cooler, but we don't see it consistently across. You can't take a band and look at all northern states, and say, oh, is it the same? Is it above a certain latitude? Are we seeing the surge? We don't see it in that way, and so some of the hope, quite quite frankly, earlier on had been that we would, because of our reasonably good vaccination rates, that we would, we all expected an increase with more mixing of people and opening of schools. And if you look at that curve, it looked for a period of time like it might have been plateauing. And so there was some encouragement. Okay, maybe we've seen this surge and it's been blunted by vaccinations, and now it'll either stay at a plateau or start to decline. And unfortunately, it didn't. There was this sort of brief period and then started rising again. And so the theories have to do with where we spend our time and how many people we're around. And I think that that's definitely a part of it. And a part of it is, there's some unpredictability with this virus that we just can't pinpoint.
Now, thank you, Dr. Belknap. It's just been one of those things that I wonder when I see, the flip of, we're doing all the right things. And
yeah. I think one of our colleagues, Dr. Bill Berman, said it best. Anybody that says they could predict what's happening with this virus, you might want to really question their judgment, because you can't. And the only other thing I would offer up is, I think we've all been humbled in the public health community with this virus and how unpredictable it is and what we don't know. And that's part of, I think, the challenge of messaging to the entire community is there's an expectation that we have the answers. And in reality, we're learning as we go as well.
Now, I know that it is still novel. One of my colleagues, it's an Adams County commissioner, was texting me because Tri-County Health Department is having their emergency meeting now, and they haven't voted yet, but she wanted to know, she heard that we were deferring, or that we're just going to do our own buildings. And I said, well, we just found out today that we're going to tailor ours. But since we've always worked regionally, it just, I would like to continue that just to eliminate the confusion, because we are bordering on, Adams County, Boulder has theirs. And you have to remember, bring a mask if you're going to Boulder or such and such. So can maybe you elaborate a little bit on why we're not going to do this as a region?
Yeah, sure. I'm happy to, Mayor. And I know that our city and county manager, Ms. Hoffman's on the call. I think it really came down to two things for Broomfield that's different than the rest of the region. One is that we don't have that level of capacity to implement that voluntary vaccine program that the other counties do. So they're using a lot of their other health department staff and city and county of staff to have businesses send in a certification, review their applications, go out, do compliance visits. And as we looked at that more closely, we felt that for a public health team, that, and even for some of our other departments, it would take us away from some of our critical functions and missions right now. And talking about, again, vaccinating our 5 to 11 and boosting up our population to us, that seems like to be the most two critical strategies for Broomfield right now. The second thing is, as I shared with, I already spoke to those other public health directors on the decision we've made, is we really want to try this as the first step with our community and our business community. And we'll see where it goes. If we see that our transmission and hospitalization rates are going in a different direction than the rest of the region, we're ready to act quickly and be able to align with the region.
Thank you. I appreciate that information, and knowing that it is a resource and capacity issue, and that we all have to kind of, make these decisions based on our reality and what we can.
And one other thing, Mayor, that played into the decision making is we're looking over like a 1 month time frame. And as we were considering standing up a program like this over a month period time frame, it really left us with one option: just do a universal indoor mask mandate, which then we considered what would be the impact to the entire community. Or secondly, to try to implement that program over a month period of time. And we just felt our ability to reach out to the business community, get them educated, and being able to implement it was limited with our current capacity.
No, I would agree. It's a heavy lift. Well, thank you. That's all the questions I have right now. So I appreciate it.
Councilmember Marsh Holston.
Evening. Sorry, my camera for whatever reason is deciding not to work tonight. This is my first Zoom meeting on my city laptop, so I haven't been able to get to work. I want to appreciate everything you guys are doing and the work you're doing. A couple thoughts that I had when I was looking at the different emails, kind of along lines with Mayor as far as the regional approach, but then I feel like you answered that sufficiently. The other question I guess the concern I have is it seems like the individuals that would be most likely to spread the virus are going to be the ones that are going to have a problem going to businesses that are going to be masked and businesses that won't enforce the mask mandate type of thing. And so I guess what are your thoughts on how we get compliance in that regard? And then secondly, on what you just said, if the science is there that we need the mask, isn't it more effective to just do a mask mandate? And if we don't have the capacity to do the voluntary program, leave that aside? And to me, wearing a mask is not a very problematic thing. It's not intrusive to me to wear a mask. So I guess that's the question I have is why not go forward with just the mask mandate and leave the voluntary compliance, the vaccine thing aside?
Yeah, it's an excellent question. I think one thing that when we were looking at this and considering it was your point of, will those individuals wear masks in public settings? And we were going back and forth, well, will we see them wear masks when they're hanging out with their group of friends and others, which could also lead to transmission. So they may put their mask on when they're going into the store and other places, but still hang out in settings where transmission is occurring. We don't know the answer to that yet. I mean, that's one thing. The second, so will they comply basically was the question. The second thing is why we wanted to, again, try this step first before moving to the universal mask mandate is we know this is an extremely controversial topic based on some of the decisions we've made in the past. And we want to work with our business community so that they're not put at the front lines of having to deal with upset customers or others who don't want to comply with a universal mask mandate. So we were trying to take the approach of let's work with the business community and our community in general to get overall compliance and see if that works versus just mandating it across the board. And Deb or Ms. Hoffman, Jennifer, if you guys want to add anything else, feel free to.
That makes sense. Thank you.
Okay. Councilmember Lim.
Yes, I guess I'll just follow up on that first. I did have another question. So you said something that we, part of this limited policy is that we would just encourage residents to choose wisely about where they're going. And I'm not sure that fits our employment profile in Broomfield. So we have I think the statistics around 80% of people coming into work in Broomfield and 80% of the people going out of Broomfield to work. So that has always, that data to me has always supported the idea that it would be a regional approach and that Broomfield would have the same kind of policy as the rest of the region. So, I mean, people can't choose if they're going to go into work, if they're coming from Adams to Broomfield or Broomfield to Adams. And that's why it made sense to me that it had to be a regional approach, if anybody wants to address that.
Yeah, another valid point of the consistency across the region. I think when we were looking at this, again, looking at our overall case rates and looking at our hospitalization rates were not seeing a dramatic difference in Broomfield versus Boulder and Larimer counties that have these types of orders in place that it's mandated. The second part of that, I would say, is, you know, our first goal is to get those individuals vaccinated that are maybe in those vulnerable situations. So either first dose of vaccinations, as Councilmember Hinkle was mentioning, getting it to people that want it and don't have it yet, or secondly, that we get the boosters out to people that are eligible to receive it. And I saw Jennifer was coming off mute. So Jennifer, do you have anything to add?
Yes, for both of the last two questions, from the regional approach.
Lost you, Jen.
Your audio is spotty.
Sorry about that. Is that better?
Yes.
Again, the unique numbers, when Jason and Deb look at whether we go the regional approach, and we've always said that we were going to let the data drive what the decision was. And so with the data that we have on both of those points, from the transmission, the high number of vaccinated, the low number of hospitalization, those three prongs is what is leading us to a decision. And so whether folks work in Adams County or transfer back and forth with a more stringent mandate, the more stringent mandate is not in place now. And yet those three-pronged approaches look very different in Broomfield than they do in Larimer, in Boulder, in Jeffco, and in Adams. So again, from the fluidity approach, there's do we go regional even though our data isn't supporting? Our data doesn't look like those other counties look. And to Jason and Deb's point, when we look at the business community, and some of the not robust feedback, but the feedback that we've been receiving, particularly from our vendors and our small businesses, as we go into the holiday season, if the data isn't reflecting a more stringent approach, then that's our recommendation is that we don't take that stringent approach because the data just doesn't support it. If in fact the data would at any point, Jason and his crew obviously look at this daily, we would enact a more stringent requirement. For those going to restaurants, small businesses, shopping, the mall, at Flatirons, at this point, it's really kind of the value judgment will be in alignment with those businesses. So if the businesses if they have required their folks to get vaccinated and masked inside, then those individuals that value those two components, that's probably a place they're going to go and spend their money. When residents call, whether it be a small business or a larger business or any kind of retail, if they say, you know, we're not going to require you to mask, and we don't require our folks to get vaccinated, then those value alignments will dictate where those folks spend those funds. So we've always said that we'll follow the data. Jason and Deb are doing just that. And so if the decision is made that we want to go away from the data because of the regional approach, that's a different discussion and decision.
Thanks, Jen.
Okay, my other question is about boosters. Do we have any idea if the availability of boosters is an appointments in particular? I think the booster is there. It would be the availability of appointments is keeping up with the demand now that we have the whole nation now saying that everyone should get a booster once their 6 months is from the second shot is finished.
Yeah, I'll start. When you just look at our data as far as uptake with boosters and the 5 to 11-year-olds, we're seeing that uptake that's there. But as far as getting in for the appointments, Deb works most closely with our providers and partners. So I'll let her address that.
Sure, thanks, Jason. So as you noted, I do believe that not only was there continue to be capacity within our providers to make appointments, there are still some walk-up options. Certainly, we've seen those appointments book out further once the announcement was made that everyone is eligible, but appointments are available. It just might not be same day if someone wants a confirmed appointment. We've been working really hard to have mobile bus and pop-up options around the community just to supplement what our providers through the pharmacies and healthcare here locally in Broomfield are able to do on their end. And Thursday, the bus was at the Broomfield Library. Saturday, the bus was at the Broomfield Community Center. And through those two events alone, we gave, I think, approximately 550 booster doses, which we believe, again, we weren't verifying resident status, but we believe a lot of those were indeed Broomfield residents. In addition, we're also providing pediatric doses, initial doses, and flu through those opportunities. But for boosters alone, just in the past couple of days, we've been able to make some pretty significant access, and the bus will continue. We're at one of our elementary schools last week. We'll be at another one this week. So just really trying to go to places where there are a lot of individuals and serve whole families in those settings, regardless of what you're seeking. So I think we'll continue to see more and more availability as we have this initial surge in demand as far as appointments through the providers and pharmacies. But to our knowledge, there still is capacity out there. It just may be that if you want an appointment, you have to book a little bit out, but that'll level out in the weeks ahead.
Okay, thank you. Those are my questions.
Thanks, Councilmember Lim. Councilmember Anderson.
Thank you. I have a question about the data behind the vaccinated versus unvaccinated numbers in the hospital capacities. Is there buried in the data, or is there any conversation about tracking, for those who have been vaccinated, how long ago they've been, has it been 6+ months or less than 6 months? Is there any discussion about starting to track the date that if people originally vaccinated received the booster shot?
Yeah, so I believe the state does track that, and they look at vaccine effectiveness over time by age groups, and they look both at cases and hospitalizations. Obviously, what they say is that the vaccine effectiveness goes down over time over that 6-month period for potential breakthrough cases. And then with hospitalizations, you still have that high level of protection against severe COVID hospitalizations and deaths, but you see more breakthrough hospitalizations occurring within the older adult population or the immunocompromised populations. Hence the recommendation to get your boosters 6 months out. And Dr. Belknap, feel free to add to that.
Yeah, no, I would just reiterate what you said, but just add. So if we look at, and I've not seen the data specifically that you had talked about. I think it may be there, but I've not seen it that says how long since vaccination. But we do know that the average age of people who are being hospitalized who are vaccinated is much older than the average age of the unvaccinated population. And we know that vaccines, the rollout of vaccines originally was started with older individuals. And so we've got an older population that likely had access to the vaccine earlier. So odds are that they're further out from completing their vaccine series. It's also a population that we know has less robust immune response to anything, including the vaccination. And so that's where we're seeing the breakthrough infections and hospitalization really is in that older population. And the average age is something like 70+ for vaccinated hospitalized, and it's closer to 50 in the unvaccinated hospitalized group. So that's kind of indirect evidence of what you're asking about.
Okay, thank you. Yeah, that's helpful. And then I have one question about if you receive, some people are saying you should continue the same vaccine that you were on for the boosters. And sometimes I see that it's okay if you had the Johnson & Johnson, especially for younger women, it's okay to switch and do another one. I would love to hear some clarity on, is it okay to mix and match?
Dr. Belknap, that's you.
Yeah, happy to. So yeah, there is some data on this, and the data supports that it's okay to mix vaccines. There's also good data on booster data that says getting a third dose or a booster dose of the same vaccine leads to good response, good. So when I've been asked about this by patients or family or friends, whomever, I tell them I think it's okay to get a booster with the same vaccine you've gotten. I think if you prefer to get it with a different type of vaccine, and probably the most common in that scenario is people who got Johnson & Johnson and which has been shown less effective overall, and say, I want to switch to the mRNA, is that okay? My answer to them is yes. I think it's safe, one, which is always important. Is there any concern that by mixing you would have some safety issues? And we've not seen that. And in terms of effectiveness, yeah, it's very effective when people get different, vaccines that are slightly different. It's been very effective.
Okay, thank you. And then one last question on that one. Then, if you say you did have the Johnson & Johnson vaccine, and then you decided to switch to Pfizer, for example, would you just need the one dose then? Or is that getting too far into the weeds?
It's a fantastic question. And my short answer to that is we don't know. And so if it's someone who is immunocompromised and so may be less likely to have responded in the first place, then I say, yeah, just go ahead and get a 2-dose series. If it's a younger person, because a lot of the folks who got Johnson & Johnson when it first came available were younger people without any other health problems. I think a single dose booster with an mRNA vaccine is fine.
Okay, thank you. And I appreciate ongoing effort to do what we can to slow the spread, understand the hospital capacity, and I'm just going to follow your lead and ready to do whatever we need to do to slow the rate. Thank you.
Thanks, Councilmember Anderson. We have any other questions from council members? So I guess what I would say in summary is what we're seeing statewide is significant strain on the hospital system, actions needed. What we're seeing is at the regional level, based on hospital numbers, the region is looking to take action to reduce transmission through indoor mask orders and a voluntary vaccine program. Here in Broomfield, our hospitalization numbers aren't as high. We're going to encourage all of our residents and businesses to step up, do the right thing. We think that we will help contribute and reduce hospitalizations that way and transmission. And we'll see where the numbers go. If it doesn't work that way, we're ready to take swift action to go a different direction. Appreciate you all, and thanks for all the feedback.
Jason, when is our next COVID update on council? Is it the 7th?
The 7th of December.
Okay, so we'll have a pretty good idea in a couple weeks.
Yeah.
All right.
All right. I appreciate you all.
Thanks, everyone. Have a good night. Happy Thanksgiving.
Thanks. Good night.
Happy Thanksgiving.
Good night.